Welcome to the 3-Minute Radiologist. Today we'll talk about the difference between consolidation and atelectasis. At left is an example of right upper lobe consolidation, and at right is an example of right upper lobe atelectasis, also known as collapse. In both cases, the affected lung is too white. So how do we tell the two apart? In consolidation, the affected lung is normal in volume. In the case of right upper lobe consolidation, the minor or horizontal fissure separating the right upper from the right middle lobe is normally positioned. The diaphragm is normally positioned. The trachea is midline. In right upper lobe atelectasis, there is volume loss. The minor fissure is superiorly displaced. The right diaphragm is elevated. The trachea is deviated to the right. These findings indicate volume loss. Let's go back to our examples. In the case of right upper lobe consolidation at left, lung volume is normal with a normally positioned minor fissure and right diaphragm. The trachea is midline. In the case of right upper lobe atelectasis at right, the minor fissure and right diaphragm are elevated, and the trachea is deviated to the right, indicating volume loss. It's important to know that I picked the most textbook examples possible for consolidation and atelectasis. In some cases of consolidation, there may also be some atelectasis. And not all cases of right upper lobe atelectasis will have tracheal deviation and diaphragmatic elevation. But fissural displacement occurs in all cases of atelectasis. Unfortunately, the fissural displacement may be hard to see. An easy way to remember the difference between consolidation and atelectasis is to think of the lung as a balloon. The normal lung is filled with air and is black on X-ray. In consolidation, air is replaced by white soft tissue density like blood or pus. Lung volume is normal, but density increases. In atelectasis, air is removed and not replaced, so lung deflates, leaving only the soft tissue components. The result is a small white lung. Think of atelectasis as a deflated balloon. Consolidation and atelectasis may involve an entire lung, a lobe or lobes, or segments/subsegments. One last thing, I've made it seem easy to differentiate consolidation from atelectasis based on the presence of volume loss. In many cases where the lung is too white, it can be hard to tell whether volume loss is present. And in those cases, I have to give an unsatisfying diagnosis of atelectasis versus pneumonia. Sigh. Thank you.